সম্মানিত দর্শক ও শ্রোতা, আজ আমি শিশু স্বাস্থ্য চ্যানেলের পক্ষ থেকে ওয়েলকাম জানাচ্ছি। আজ সংক্ষিপ্ত আকারে rheumatic fever সম্পর্কে বলতে চাচ্ছি। Rheumatic fever is a systemic disease of childhood, often recurrent for a group A beta hemolytic streptococcal infection. It is a delayed multisystem autoimmune non-suppurative sequelae of a respiratory tract infection with group A beta hemolytic streptococcus. It is a diffuse inflammatory disease of the connective tissue, primarily involving the heart, blood vessels, joints, subcutaneous tissue, and central nervous system. Acute fever, inflamed skin, joint, heart, chronic scarring of the heart valve, mitral valve dysfunction. Immunological reaction. It is a immunological reaction 10 to 14 days after the throat infection starts. Epidemiologically, streptococcal infection, especially 3% in overcrowded school, hostel, and army camp in different situations where overcrowded, low socioeconomical condition, and 0.3% in civilian population, 50% rheumatic fever, previous history or recurrent history, the rash, erythematous, erythema marginatum, mainly involve the mitral valve in the heart, pharyngeal epithelial, the group A beta hemolytic streptococcal infection. It start to process the presentation B and T cell and generation of cross-reactivity of B and T cell and tissue organ manifestation when the cross-reactivity of antibody. Group A beta hemolytic streptococcus. It affects the heart, brain, joint, and skin, mainly on the mitral valve with stenosis. The mitral valve commissure fusion, right? Fibrous scar tissue called mitral valve stenosis. Heart, joint, skin, and central nervous system main target organ. All over the world, it spread. Major criteria and minor criteria. Carditis, arthritis, chorea, erythema marginatum, sulfurous nodule. These major criteria. Minor criteria: hyperpyrexia, arthralgia with other sign of inflammation. Laboratory diagnosis: acute phase protein, CRP, ESR, prolonged pair interval in ECG. And evidence of streptococcal infection, throat swab culture, rapid antigen test, elevated increasing anti-streptococcal antibody titer. This is the ascope nodule. Acute rheumatic fever, polyarthritis, migratory polyarthritis, carditis, erythema marginatum, chorea, subcutaneous nodule. And patient presenting as a fever, breathlessness, chest pain, swollen joint, and throat pain. So erythema marginatum, less than 5% patient has a start red macule gloss on the face in the center, but remain red at the edge, mainly on the trunk, proximal extremity. And subcutaneous nodule 5 to 7% patient, 0.5 to 2 centimeter, firm and painless, extensor surface of the bone. It is feel collagen. This is the cross reactivity of the antigen in the joint. Investigation: complete blood count, ESR, CRP, throat swab culture, echocardiography, chest X-ray, ECG, chest X-ray, their cardiomegaly, pulmonary congestion, echocardiography to monitor the heart condition, ECG, sinus tachycardia, sinus bradycardia, first degree AP block, prolonged PR interval, ST segment elevation, if marked T2, 3, FA, P4, P5. And differential diagnosis: the juvenile idiopathic arthritis, reactive arthritis, Shigella, Salmonella, Yersinia, cause these reactive arthritis: serum sickness, sickle cell disease, SLE, Lyme disease, pyogenic arthritis, streptococcal reactive arthritis, viral myocarditis, viral pericarditis, infective endocarditis, Kawasaki disease, mitral valve collapse, erosion murmur, congenital heart disease, and chorea, if present, Huntington chorea, Wilson disease, cerebral palsy, tic disorder, hyperreactivity, Perthes disease, any accidental injury, hemoglobinopathy, leukemia, storage disease, endocrine disease, sympathetic dystrophy, fibromyalgia, tumor, benign, malignant, SLE, vasculitis, dermatomyositis, sarcoidosis, juvenile idiopathic arthritis is the main exclusion of diagnosis. For diagnosis, we see the criteria, major and minor criteria, two major or one major, two minor criteria, and evidence of preceding group A streptococcal infection and recurrent attack, acute rheumatic fever, two major or one major, two minor criteria. We need to prophylaxis benzoyl penicillin 600,000 unit if weight less than 27, 1.2 million more than 27 kg every 4 weeks, and penicillin B 250 mg twice daily oral. If allergy, penicillin, erythromycin. So prevention, primary prevention to treat the group A streptococcal beta hemorrhage streptococcal infection and reduce the overcrowding, any improve the respiratory skin hygiene. Secondary prevention, regular echocardiography to detect the rheumatic heart disease, secondary prophylaxis with antibiotic. And tertiary prevention, when medical management, heart failure, complication, rheumatic heart disease, surgical intervention, valvular stenosis, echocardiography screening, always to see the condition heart. Rheumatic fever with carditis, residual heart disease, up to 40 years the prophylaxis or lifelong need probably cardiac surgery. Rheumatic fever, carditis 10 year until 21 year, even lifelong if operation done. Their cardiomegaly, pulmonary congestion, and management aspirin with bed rest, complete bed rest to improve the heart condition, congestive heart failure. If need, digoxin may be needed if severe heart failure, and diuretics, corticosteroid if with severe arthritis. So rheumatic heart disease is a neglected disease property. We need to improve our house sanitation, improve nutrition, immunity, increase the awareness of parents about the rheumatic fever, early diagnosis, management, and prevention. If chorea present, phenobarbital, haloperidol, chlorpromazine. Thank you for watching this video. আমার চ্যানেলটি সাবস্ক্রাইব করবেন এবং প্রিয়জনের কাছে পৌঁছে দিবেন।